Good evening, everybody. My name is Robert Nolan. I'm the chair of the Community Relations Committee of New York City Health and Hospitals. We're meeting this evening, November 10th in the year 2020. I'd like to thank all of you for participating, not just the hospitals who are reporting tonight, but those of you who I can see on the screen not reporting tonight, but who are active CAB members. Thank you so much for your activity. We are going to be hearing tonight from the following CABs if they have representatives who are present. And those are our health and hospitals reports coming from Harlem, Jacoby, North Central Bronx, McKinney, Kohler, and Sydenham. I want to take a few minutes to acknowledge some of the incredible things that are happening across New York City Health and Hospitals system as a response to COVID-19. And we will build to the future for the communities we serve. First and above all, I have deep appreciation for the front and first line workers, for their dedication and commitment to protect and heal our communities. I am amazed and constantly inspired by their dedication and perseverance to achieve our mission, to care for all New Yorkers, despite the ominous challenges of those times. To those workers, I say thank you. Also, I want to thank some of our unsung heroes, our facilities and engineering champions. We recently marked Facilities and Engineering Week, and it couldn't come as a more timely time for us this year. We have re-engineered our emergency departments and clinics across the system to provide safe care after COVID-19 surge. Our 11 emergency departments have undergone physical changes, and you've seen this all over the city, to maximize distance between patients and waiting rooms and care areas. New spaces for isolation and negative pressure rooms were created to help protect from infections like COVID-19. This is all on top of the Herculean work they did during the height of the COVID-19 surge in the spring. We are grateful for their technical skill and their tireless work. I also want to note that in September, we launched virtual express care services to further ensure New Yorkers have convenient, one-click access to the most appropriate care where they're safest. New Yorkers in need of non-emergency urgent care can connect to a provider in 200+ languages for an evaluation by going to expresscare.nyc on any device with a camera. The system's virtual express care launch builds on the public system's recent expansion of telemedicine offerings. I believe this will be an important support for our patients and for our communities, and I again thank the H&H team for this work. I would like to also, at this time, thank everyone who's on our meeting tonight who participated in the public hearings held in September and October, just a couple of months ago across the city. And I want you to know that already tentatively scheduled are the 2021 hearings that will occur in the spring. So you will be notified of those dates at the appropriate time when that all comes together, but be aware that those hearings, and of course your participation, nothing is important from my perspective as a representative of the Community Advisory Board of your hospital than participating in some way, and not just one person, but perhaps more than one. And finally, I know that many of the hospitals are planning legislative advisory board sessions in late January and early February. But I want to remind you, as someone who spent his entire career in city government, that legislators and council members are often making early decisions now, because the legislature takes office in January, and if you wait till January and February to ask them for something, it might be too late. For the city council, you can ask in January and February. They have exact dates for the expense budget that comes earlier. Capital comes a little later, but this is the time that your ask for capital and expense for the following year needs to be finalized. And asking on the state level needs to be finalized even earlier. So I ask you to please make that a priority at your hospitals so that you'll be in a better position to obtain funding. I'd now like to introduce Mr. William Hamer, who is representing Harlem Advisory, the Harlem Advisory CAB. And thank you, Mr. Hamer, for participating in our session this evening. Before Mr. Hamer does have a chance to speak, I would like to mention that he has been a CAB member since 2014 and chair since 2018. A longtime resident of Harlem and leader in the community, and I know in listening to what you've had to say, Mr. Hamer, I've been a member of this committee since June 30th, 2011. And I know you joined a few years later, but I've always listened to you attentively because I know that what you've had to say is an extremely important message, not just for the people in Harlem, but for all of us in the city. So with that, Mr. Hamer, welcome, and we look forward to hearing your report.
Wow. So can everyone hear me?
Yes, Mr. Hamer, we
Yeah,
can.
can you hear me? Very good. So first of all, thank you, Mr. Nolan, for those kind remarks. So good evening, everyone. My name is William Hamer, and I'm the outgoing chairperson of the New York City Health and Hospitals Harlem Community Advisory Board. This evening is my last official act in that capacity. And so it is my sincere pleasure to formally thank and acknowledge our NYC Health and Hospital President and CEO, Dr. Mitchell Katz, our board directors, Community Relations Committee, and its chair, Mr. Nolan, and Council of CABs. And again, Mr. Nolan, thank you for those kind remarks. It is with great honor that I thank our beloved New York City Health and Hospitals Harlem CEO, Ms. Ebony Carrington, who I also see is on the call, for doing what I have experienced as an excellent, outstanding job during this pandemic. And she has always, during my tenure, been very transparent in keeping us informed about hospital conditions, as well as being responsive to any complaints or concerns that we have channeled back to her from the community as our role as ambassadors in the Harlem community. So I will say that although I'm transitioning out, I will continue on the board for another year to continue to support our new leadership. And I'm glad to acknowledge that on the call, Ms. Karen Dixon, who is our new chairperson, is now on the call. And so I want to give a shout out to Karen and to let the individuals on this call know that she will be taking over a leadership position at Harlem Hospital. And I'm very confident about her leadership. And during the remainder of my year on the board, I will commit my full support to her leadership and her new leadership team. So with that, what I'd like to do is just go over some really important bullet points quickly during the time that I have to talk about some of the real accomplishments and benchmarks that have been achieved at Harlem Hospital. Due to COVID-19, Harlem has done tremendous work to improve and emphasize in-service staff education, updated signage, guidelines on COVID-19 PPE training, and COVID PPE cards. Another very important point is the Infection Prevention and Control Department maintained a 24/7 interdisciplinary collaboration, which allowed them to implement and streamline the updated guidelines with frontline and support staff to ensure a safe environment for staff and patients. Temperature screening occurs at entrance with minimum impact on waiting times. Clinics currently have great patient engagement, 20% face-to-face and 80% televisit engagement. The ambulatory service unit or surgery unit is open as a volume of emergent surgeries ramp up. And currently, Harlem is participating in several COVID-19 clinical trials. They have hosted several virtual COVID-19 update dialogues with the community, collaborating and partnering with community-based organizations and senior centers. And I have to just give a shout out that, one of those organizations is the organization that I currently head up, which is Harlem Advocates for Seniors, which has a sizable footprint in the Harlem community, providing services and support to seniors. Infrastructure equipment. The New York City Department of Health and Public Health began construction on our campus. As you know, we are doing major construction up there. There are emergency projects, relocation of various departments from the Women's Pavilion, which is being demolished, I believe, if that's correct. Patient safety and satisfaction, which is, I know, during the tenure of my leadership and Mrs. Carrington's leadership, this is something she had particularly focused on and was particularly important to her, because the patient experience is obviously a real touchstone of how successful your hospital will be. There's improvement in patient safety event reporting, thereby increasing number of safety events, safety events being reported. The leadership presented lessons learned through real case presentations through various disciplines and departments, including residents, nursing, attending physicians, physician's assistants, and clerical staff. And the clinical team has established more awareness to national patient safety goals around patient identification by creating a project to reduce errors and improve patient identification. As I mentioned, patient experience remains a priority. There's a new visitor framework and experience in which patients, families, and care teams communicated via iPads and video phones. Our patient scores remain steady. The hospital completed the 2021 strategic plan, and their 3 strategic priorities are staff engagement, culture and leadership, patient and family engagement. And of course, as I wind down this presentation, I think all of us know that there are always some downsides to our work, that although we are making great progress and we've had great milestones, there are still things like patient complaints that we have to contend with. So just want to share with you a few of the frequent complaints raised by patients and residents. Care. Some patients and their families complained about a perceived lack of attentiveness and responsiveness from nursing and medical staff. And communication. Some patients perceived poor communication between patients, family, and staff. There were concerns on following up with patients on their plan of care, appointments, and procedural details. For example, informing patients why their appointments were canceled. Attitude. There are also many grievances concerning poor attitudes from staff. And we cite those because we want everyone to understand that we understand that there's still work to be done at Harlem, as I'm sure it is with many other facilities. But I do want to say that it is a high priority on the part of Ms. Carrington and her senior leadership team to constantly address those factors. And from our perspective, as community advisory board members and leaders in our community, she has done a wonderful job of being responsive to those issues. The hospital has acknowledged and thoroughly investigated every complaint in order to provide real-time service recovery when possible. Couple of corrective action plan items: tracking and trending complaints and bringing information to the front line. That is now a high priority. And starting daily nurse leader rounds and briefings with frontline staff. So as I wind down, as I wind down my report, I want to just say that it's been my pleasure to work with the Council of CABS. I see Dr. Anthony Andrews on the call. Dr. Andrews, I want to thank you for your leadership and thank you for the opportunity of being able to work with you during that transition. I see Anthony Feliciano on the call. Anthony, I want to thank you for your very important work always in terms of healthcare issues and staying on top of the advocacy issues. I want to just shout out Warren Burks and Judy because as we all know that they are 2 people who kind of keep us moving in terms of their commentary, their insights, and their thoughts, at our meeting. So I want you to recognize and to understand that we have welcomed, at least I have welcomed that commentary and your definite and your commitment and always on the issues. So with that, I want to just say thank you to you all on behalf of myself, Harlem Hospital. I will, from time to time, continue coming down to the meetings as a participant observer, as one of the community representatives, as a board member, and I still commit full support and commitment to support the leadership, both at the HHC level and also at the hospital level. Thank you for indulging me.
Thank you very much, Mr. Hamer. And once again, thank you so much for your service. I know you have 1 more year on the CAB, and we look forward to your participation during that time. And I'd like to congratulate Karen Dixon and welcome her as chair, and we look forward to her participating in that capacity in our meeting that will be held in January. I would like to now introduce the CEO of Harlem, Dr. Ebony Carrington, who would like to speak, of course, of Mr. Hamer, and then give Ms. Carrington an opportunity after that to address any of the issues that were raised by the Harlem CAB under frequent complaints. Ms. Carrington, the floor is yours.
Excuse
Thank you,
me, Mr. Nolan. I'm sitting here with the report from Jacoby. And according
Class.
to the list I have, we're supposed to go first.
Sylvia, how are you this evening?
I'm okay, but I've been sitting
Okay.
here so I would like to give Jacoby's report.
Sylvia, we are moments away. According to my list here, Jacoby is reporting second. So if you be patient for another couple of minutes, we're going to hear from Ms. Carrington, and then we're going to give you the floor representing Jacoby.
Okay,
Thank you, Sylvia.
All right, thank you, Bob.
You're welcome. Ms. Carrington, the floor is yours.
Thank you, Mr. Nolan. And I just wanted to take a few brief moments.
Yeah, we've lost Ms. Carrington.
Of
Oh, I
don't-
thought it was my phone.
For everybody. Hello?
Hello?
Yeah, we've lost her.
We've lost Ms. Carrington for now. Do you want to
I'm
move
sorry.
on and let's
Can you
wait
not
and
hear
we'll
me?
try to reconnect? Okay, we're going to move on. We'll try to reconnect with Ms. Carrington, who has a couple of things to say. And
Mr.
then we'll
Nolan.
reconnect with her. Yes?
I think, Ebony, are you on? I can hear your voice, though I can't see you.
Yeah, we're going to move on. Thank you so much. We will bring Ms. Carrington back onto the meeting when she's able to be heard by all of the people who are on the call. I'm going to move on to Jacoby and Mrs. Sylvia Lask, the chair of the Community Advisory Board. Ms. Lask, I hope that you're feeling better. I did get your
Thanks.
message along the way, and I'm glad to hear your strong voice. The floor is yours as the head of the CAB at Jacoby Medical Center.
Okay, before I start with the report, I would like to give special thanks on behalf of the board to Mr. Mastriano, who works so closely with our board and keeps us aware of everything that's going on. So this is Jacoby's report for the year 2020. 1, COVID-19. The COVID-19 crisis had a major impact in New York and on the Bronx community during the peak months from March through May and continues to present challenges. As a major public hospital in the Bronx, Jacoby's response to the pandemic included the following. ICU units and medical units expanded to treat COVID-19 patients. 13 patient rooms were built in the same-day surgery area to keep sick COVID patients who needed isolation. Changes made to the building maintenance system to allow for more outside air in the building and increased number of air exchanges per hour. Converted an ambulatory care area from pediatrics located on the first floor into a place where anyone with symptoms is evaluated upon entry. Evaluation area still in existence. Tent set up outside the ER to provide COVID-19 assessment. Army personnel arrived to support the facility's efforts. Guidelines established for protective equipment, masks, and social distancing. N95 mask distribution for inpatient unit nursing staff at a central area. Enhanced cleaning protocols were implemented. Drive-through COVID-19 testing and antibody testing in the facility. Jacoby's Helping Healers Heal initiative, a team of staff who provided emotional support to other staff. New visitation hours and rules, COVID-19 screening, limited visiting on designated units where patients had tested negative for COVID-19. Ambulatory care reopening that focused on the safe welcoming of returning patients, including adjusting schedules for social distancing, wait rooms with signage, reminders, protective plexiglass barriers at registration areas, and enhanced sanitation of exam and wait areas in between visits. Communicated relevant information through a variety of venues, including internet flat screen systems throughout the facility, e-blast message from CEO and medical director, virtual town halls and signage, point of entry self-screening. Recent improvements at the facility include plastic barrier work, new exam room in the atrium for rapid assessment of patients, and new CRRT machines. Additional infrastructure equipment needs include renovation of the mother-baby unit into single rooms. Most are double rooms without private bathrooms. Creation of additional ambulatory care for the service to meet patient needs. Expansion of a centralized patient monitoring system to additional floors, 12 beds on 3B to become an ICU, 23 beds on 3A. Additional sonogram machines, women's health, cardiology, and medicine. Replace nurse call system for patients to contact the nurse from the bedside. All projects are on the capital request listing, and we are working with central office on identifying funding. Jacoby's direct care providers and hospital staff received well-deserved acknowledgement and gratitude from patients, families, and community for their hard work and dedication throughout the COVID-19 crisis. They appropriately were known as Jacoby Healthcare Heroes as they continued to provide high-quality medical care and compassion during extraordinary challenges. 4, frequent complaints raised by patients. Most frequent complaints raised included wait time in the ER for relatively minor complaints and patient access to care. ER wait times have been greatly improved from improved staffing and changes to patient flow. Currently, the average wait time from arrival to seeing a physician is 30 minutes. Thank you very much.
Thank you
And
very much.
Again, I want to thank Mr. Mastriano for being so open with the board and keeping us aware of everything that's going on.
Thank you very much, Ms. Lass, for your report. I think you'll also want to mention that you're having a CAB meeting, I believe it's this Thursday night, correct? I believe that's at 5:30. Yes.
I think so, yeah.
Because it's on my schedule. I'm looking forward to it. I have no questions for you. I want to thank you and Mr. Mastromano for your presentation, Mr. Mastromano for his input on the report, and that I'd like to move on from here. Thank you so much, and please take care of yourself, Sylvia.
Thank you, and send my best at home.
Will do.
Okay, bye-bye.
We're going to move on. I want to remind everybody that we need to end this meeting by 6:30, of course, so that the CAB meeting can begin. And we do have now 4 additional speakers representing 4 hospitals, and then Ms. Carrington. But Ms. Carrington, can you hear me?
I can. Can you hear me?
I can hear you, so I'd like to go to Ms. Carrington. Hi, how you doing? It's good to see you.
I'm very well, thank you.
I haven't seen you
Thank
since
for the time.
March. I haven't seen you
know,
since
and I'm happy to
March,
see your face.
so it's good to see you. Please,
Thanks.
I had asked, I know that you want to speak of the fine work done by the outgoing chair, and I'd also like you to address yourself to some of the complaints that were made by the CAB, many of which have been resolved already. So in which order you want to do that, the floor is yours.
Sure. I also wanted to, and was prepared to speak very briefly, but at a high level, about our participation in some of the COVID clinical trials, both on the inpatient and outpatient side, just for the record. So Harlem Hospital participated, and we have 2 principal investigators that are very skilled within the research realm in several different clinical trials during the COVID period. The first one was around IL-6. The second was remdesivir. We worked on some convalescent plasma studies, as well as what we call sarilumab. And those were all programs that we participated in throughout the duration of the COVID pandemic. We have opened up an arm of our research branch of the hospital to focus more specifically on this pandemic. And so we also have ongoing clinical trials around antibodies and anti-spike, which are some of the things that you're hearing throughout the country. So I wanted to bring forward the opportunity for our patients to have received some of these services. We were disproportionately impacted within the Black and Brown communities, specifically in Central Harlem. And so I wanted to be able to share, and have shared with our CAB, my excitement about our participation in clinical trials. Related to the complaints and the grievances, as mentioned, we participate because of the condition of participation by CMS in a 7-day response to our patient grievances and complaints, but we go one level deeper in that we try to root cause the nature of the complaints. And so when we talk about care or we talk about attitude, we need to drill down to appreciate whether or not these staff members were appropriately oriented, whether or not they're experiencing signs and symptoms of burnout. And what we're finding post-COVID is that people are unaware really of the current mental condition that they bring with them to the workplace, and that some of the body language and some of what they're feeling outside are really impacting the work that they're doing inside. And so we work collaboratively with our H3 team, but also have really talked with our leaders about de-escalation, about team building, and about really the contagion that is gratitude and showing your staff the appreciation so they in turn can demonstrate that to the patients. So in addition to what you've heard from Mr. Hamer, those are some of the things that we're doing to work on our care complaints and grievances. And then I just have to say, because we have to expedite the meeting, no greater CAB chair could you ask for as a CEO than someone who is transparent and collaborative, who invites you into the community, who provides you their reputational credit and capital. And so there is nothing but effusive praise that we provide and give to Mr. William Hamer. So I just want to also say thank you for your work and for all that you have done for Harlem. So it's been an outstanding opportunity to work with you, Mr. Hamer, and I look forward to Ms. Dixon as well. Thank you, Mr. Nolan, for the time. And I apologize for the technical difficulty.
Thank you for those words, Ms. Carrington.
Thank you, Mr. Hamer. Thank you, Ms. Carrington, for your report. And I'm going to acknowledge the presence of Dr. Mitchell Katz, our president, who has now been able to join the meeting, and let him know that we're about halfway through. I'm about to introduce the head of the North Central Bronx CAB, Ms. Esme Satur-Low. Esme, can you hear me? Esme Low, can you hear me, Esme?
Yes.
Good evening.
Can you hear
How
me?
are you?
Good, I'm fine. Good afternoon to everyone, Dr. Katz, and their respective place. I just want to update for North Central for the COVID response. During the period of March 1st, 2020 to June 13, 20, North Central Bronx received 209 transfer of COVID-19 patients from the various facilities. There are a total of 513 COVID admissions during the 209 served plan, which initially created 102 additional beds. Construction on the 10th and 15th and 16th and first floor commenced in March, the FEMA projects, which provided additional 120 ICU beds plus the ED surge area as of June 3rd, 2020. And another part of the waiting situation, the art of the waiting project was designed to set a proper expectation and create positive perception for every patient that arrives in the outpatient clinic by improving the communication of wait time, starting as a point of entry and various intervals during the patient visit. The key was communication. The PASS Act consists of patients and family members who have received care at NCB and administrator, clinics, and staff. The purpose is to promote a culture of patient and family-centered care within our organization. One of the main roles of the participate in the various improvement projects. The goal is to have every staff member adopt the iCare. This is a model of custom service standard for healthcare professionals at NYC and H&H has adopted the iCare to help us in our commenting to provide our patient with best possible experience. And I want to thank the staff at Central Office for all the additional construction and my liaison, Alex Hernandez, and Ms. Contreras for all the diligent work helping from Dr. Cass. And thank you very much for listening to our report. Thanks.
Thank you so much, Ms. Satur-Low. It's good to hear your voice again. I wanted to know if Ms. Contreras was on the line or anybody else from administration at NCB.
Hi, Bob. I'm here.
Hi, how are you?
How is everyone?
I wanted to specifically ask you about and also commend the hospital regarding the second item that was mentioned, that the FaceTime interactions were made available with patients who were in labor and allowed to have a support person remain with them. Because we've heard about all the reports of people denied an opportunity to go to a hospital, to go into a medical facility over the last 6 to 8 months. And I'm happy to read of that. And I'm happy to read of the fact that you have your hospital visitation pilot program, which enabled visitors to come and visit those persons they could at your hospital. And I'm sure that perhaps is expanded by now, because we know that when people are in the hospital, they want to see their family. And I know it's very, very difficult with the COVID virus to do so. But if you'd like to speak to those one or two things, I would appreciate it.
Absolutely. No, it was very critical for us at the time. It was, breaking our hearts, the fact that people had to deal with the family members being in the hospital, and we need to make sure that not only the hospital staff, but the patients and the visitors were granted the opportunity to have some interaction. It's definitely important for them to receive the health care, but it's also important to help the healing, to have family members come in as long as they met all the requirements of the guidelines that we put in place to ensure safety. But we were proud to be part of the pilot to make sure that we were transitioning and helping the families to heal better. So it was a good opportunity for us.
Yeah, it was 18 years and over, which is a good safety project, 18 and over.
Yeah, it was very successful, actually. Very successful.
One more issue that caught my attention last week during the briefing, which I cannot allow to go by. Obviously, I am behind many of you because I was unaware of the art of waiting. And if you would just speak about the art of waiting which has come to me at a very late age, but I'm very happy to hear of what the initiative is and how it's working effectively at your hospital.
So it's definitely working effectively. The art of waiting is designed to set proper expectation, as indicated by Ms. Esme, and it creates a positive perception of every patient that arrives in the outpatient clinic. Improves the communication or wait time. It's setting the expectation by letting them know what to expect in reality. I mean, we can't really get rid of the wait time, but it's having someone understanding more or less how long they have to wait. It helps for them to make better decisions, but it feels more respectful. So it was definitely helpful.
Ms. Contreras, thank you very much. And Ms. Satua, thank you so much for your report. We deeply
Thank you.
appreciate your presentation this evening.
Thank you, everyone. Thanks. Thanks.
I'm going to move on and introduce Mr. Jean-Pierre from McKinney Hospital. Mr. Jean-Pierre, can you hear me? Mr. Jean-Pierre? We will move on and come back.
Hello?
Mr. Jean-Pierre?
Yes,
Mr.
can you hear me?
Jean-Pierre? Yes, this is Mr. Nolan. How are you?
I'm fine, and yourself? Good afternoon.
Good afternoon. We're ready for your report, Mr. Jean-Pierre.
Yes, good afternoon, everyone. Protocol has already been established. I just want to start with McKinley's annual CAB report. The first section is the COVID-19. Under the clinical leadership of Dr. Harlem, Chief Medical Officer, and Ann White Akinyo, Chief Nurse Officer, clinical plans were put in place to help diagnose and successfully treat many residents with COVID-19. Staff became extended family members to our residents to care and comfort them, to hold their hands, relieve their anxiety, and provide companionship. In regard to Section 2, our infrastructure and equipment programs, in the planning for new innovative ways to provide safe and quality care for our residents, McKinley has embarked on a number of initiatives. Renovation of the 3 elevators are nearly complete and should be completed by the spring of 2021. A new nurse call bell system, fire alarm system, and elopement detection system are in the planning phase. Telemetry services, which will allow McKinley to better monitor the residents, is also being installed. And in addition, McKinley is now implementing an in-house dialysis center for our residents, which is a great news because now they no longer have to go outside the facility 3 times a week for dialysis services. Our next section would be the resident safety and satisfaction. Throughout the COVID-19 pandemic, all infection guidelines were implemented as to ensure the safety of our McKinley residents and staff. 2 recovery suites, totaling 23 beds, were set up and staffed to safely treat residents with COVID-19. Although visitors were not permitted on site until late October, residents' family contact was maintained through telephone calls, social media, and window visits. A number of community-based organizations sent cards to the residents to help alleviate their loneliness, and the auxiliary donated all the items in McKinley gift shop to the residents, which were distributed among the residents. In regard to our residents' concern, residents shared little to none complaints at the residents' council meeting, which was conducted on a one-on-one basis on the residents' bedside due to social distancing requirements. Questions was asked as to when on-site family visit will once again be permitted. And I am happy to say Mr. Weinstein has informed me that visits started October 26th, where family members, after thorough screenings, are allowed to visit their loved ones. All social distancing protocols is being adhered to. Although social distancing and visitor requirements reduce ability to meet person with McKinley leadership team, I have kept up to date with facilities operations by the Chief Executive Officer, Officer David Weinstein. I am not aware of any significant complaints at this or concerns. On another brief note, the public hearing, I brought up two concerns about one, protection from staff layoff, and two, on-site meal preparation, because I know food is done on premises at Seaview. Mr. Weinstein did immediately respond to me, informing me that there was never any intent to lay off any staff. And two, McKinley has been planning to enhance dining experience for our residents. One major objective is to provide meals without the traditional tray. In other words, serving each course one at a time, familiar to restaurants. McKinley was planning to position in this early 2020 until COVID restricted social gathering of residents and the communal dining. However, they are looking forward to getting back to the plan as soon as restrictions are lifted. Finally, Ms. Benjamin from the auxiliary spoke about gratitude and empowerment classes. She was informed of the Helping Healers Heal program, where staff was and continue to be debriefed by H3 leads. I heard staff was very grateful and responsive. David Weinstein conducts town hall meetings where all systems changes are explaining to staff, and where staff has also been given the opportunity to email him and any other concerns. The care and compassion delivered by McKinley staff leaves the Community Advisory Board very satisfied with the quality of care given to the residents. Thank you very much. This concludes my report.
Thank you, Mr. Jean-Pierre. I appreciate it very much, especially and members of the board, that you were able to tell us that the on-site family visits were back, and they actually started on October 26th. So congratulations to Mr. Weinstein and his administration there at McKinney. I did want to ask about the one-to-one meetings that you had previously, because the social distance requirements, I just want to clarify, are they not being held because of the closeness needed to have the one-on-one, or are they being held because you can sit or stand 6 or 7 feet away and you can still ask a question of one of the residents?
I believe Angela would be more qualified to answer that question, but I think it's the latter part that you just mentioned, that we could stand at a certain distance and ask the appropriate question.
So who wants to respond to that?
I can respond. This is David Weinstein, the executive at McKinney. Hello, everybody.
Hi, Mr. Weinstein. How are you this evening?
I'm good. Thank you, Jean-Pierre, for your very thorough and exhaustive report. In terms of social distancing, we are very mindful of setting up protocols around the building for staff and residents. When it comes to the family visits, yes, we have brought them inside, and they are socially distanced, which means there is a monitor in the room, just making sure that unfortunately, there's no hugging or kissing allowed of families, and that's difficult to have to deliver, but it's necessary. Family and resident are situated 6 feet apart. Both are wearing masks. Families present negative COVID tests taken within 7 days of visiting. And of course, our residents are tested rather weekly, if not regularly. So we know we're in a safe zone, but we are maintaining a social distancing when it does come to families. Thank you.
Thank you, Mr. Weinstein, for clarifying that. And thank you, Mr. Jean-Pierre, for your report. If there are no questions from any other members of the board, we will thank Kohler. We will thank, McKinney, and we will move on. Okay, hearing none, I'm going to move on. Is Judy Birdie available? Judy, can you hear me? Miss Birdie, Judy Birdie.
Yes, I'm here. Yes, can you hear me now? Good evening.
Hi, Judy. How are you this evening?
Wonderful. I bring greetings from Roosevelt Island. And
greetings.
Yes, we're still in thank you. We're still in offshore territory. With COVID-19, throughout the COVID-19 pandemic, COLA administration worked closely with the post-acute care and system leadership, as well as following all CDC, CMS, New York State DOH guidelines to ensure the alignment of infection control and other clinical practices. The CAB received routine updates from administration through the height of the pandemic, enabling us to continue to perform our role during this time. In line with the regulatory guidelines, restrictions were placed on visitations and are now permitted available 7 days per week if the facility has gone 14 days without a new COVID-19 positive test for a resident or staff member. All personnel entering the facility are required to have their temperature checked and screened for COVID-19 symptoms. Staff are also required to wear masks in the facility at all times. In addition, all residents and staff are tested weekly for COVID-19. The facility has also dedicated units for COVID-19 positive residents and those with unknown status to ensure safety for all residents and staff. Our infrastructure and our equipment. COLA has successfully completed a partnership with New York City Emergency Management for placement of HESCO barrier fortifications around the campus. These barriers will protect the campus perimeter against coastal storm surges similar to those experienced by Superstorm Sandy. These flood barriers are in place. COLA is currently installing new bedside TVs on 2 resident units as part of an eventual complete TV upgrade, which has been undertaken as financial resources permit. With completion of the 2 resident units, COLA will have upgraded TVs in 6 of its residential units. Funding for the TVs was provided through the generosity of the COLA Auxiliary. For the comfort and safety of its residents and their guests, COLA has erected a temporary heated tent that will allow safe, socially distant visitation. This will enable COLA to continue to comply with New York State DOH COVID-19 guidelines to limit visitations to outside in most cases. COLA has successfully constructed 4 new chair dialysis units during COVID emergency declaration and is operating at near capacity. This on-site dialysis means that residents no longer need to travel outside the facility 3 days a week for the service. COLA will replace its existing temporary emergency generators and outdated annunciator system under new permanent emergency generator project currently in design. The target for completion is November 2021. Patient satisfaction. COLA has made great efforts to provide a safe environment addressing the physical, emotional, and psychological needs of our residents, enhancing the quality of life. In addition to providing accurate and up-to-date communication to its residents and their family members has been top priority to ensure continuity of care and promoting care partnership. COLA is one of a select group of New York City Health and Hospitals facilities to participate in Plaintree, an organization guiding healthcare facilities in building patient-centered care and enhancing the patient experience. Plaintree works with healthcare organizations on an international level and is recognized leader in the field of patient-centered care. CAB members, residents, staff have participated in focus groups, generating valuable information, ideas that will help guide the initiative. Frequent complaints raised by patient residents. Resident complaints raised during this time included concerns about the inability to go out of the facility or leave their unit during COVID restrictions. The facility addressed this by expanding the hours of the courtyard is available for residents for outdoor time during the day and evenings, each day of the week. Therapeutic recreation also continued to provide additional unit-based programming to meet the needs of the residents during this time. Other complaints concern the enhanced cleaning that needed to occur as resident bedsides. This issue raised focus on handling of residents' property by staff during these cleanings, as well as timely notification of the resident. These cleanings are pre-scheduled 48 hours in advance and resident notification is made. Also, supervision is provided for these cleanings, which are conducted with the residents' participation. Other items. Through New York City H&H Arts and Medicine, Kohler is having a community mural painted and installed. This project is a creative opportunity to engage our staff, residents, and community stakeholders to create a mural that represents Kohler. Members of the CAB, resident staff participated in the design of the mural painting process. We are very pleased at the final mural design and are eager for the installation, which is scheduled for this Thursday. I also want to tell you that we have a CMS 5-star rating for our facility. We were rated top in New York Newsweek magazine, and Kohler is doing very well. It's been a little bit of a struggle, but we have a wonderful garden and a yard and a beautiful area, and with this wonderful weather, we've been able to make sure our residents get out, get a lot of fresh air. Thank you very much.
Thank you very much, Ms. Birdie, for your report. I'd like to recognize Dr. Katz.
Mr. Chair, I want to thank Judith for all the effort, and also say we had another victory, which is Wi-Fi coming to Kohler at a much higher, frequency. So there was Wi-Fi before, but many residents expressed that it was not fast enough. And living with 2 teenagers, I understand that not having fast Wi-Fi is essentially like there's no food in the refrigerator, there's no water. We run a society, including this meeting, that requires broadband, and people at Kohler are entitled to that same broadband. And thanks to Kim and Jeffrey Lutz in our IT department, they now have it.
Thank you. Mr. Hughes is here. Thank you.
I'm sorry, go ahead.
No, Mr. Hughes, our executive director, is here if you have any questions for him.
Okay, I want to thank Dr. Katz for making that announcement. We all realize how critically important it is that we have Wi-Fi, and as somebody who lost his cell phone and then forgot the password to his Apple account, I want you to know there are a few things in life that are worse that you go through for 8 days than not knowing that. And believe me, as much as I remember everything else in my life, I will never, ever again forget the password. And I encourage all of you, write it down in multiple places in your homes.
Just tell it to us and we'll write
Yes,
it down so we'll
remember
remember it.
Just tell it to Dr. Katz. He has time in his schedule to remember all of your Apple passwords. I did want to ask you, commend you on the fact that the courtyard was open for all the residents out at Kohler. But then, of course, we know that this may be the last day of really comfortable weather. And I hate to say it, I hope I'm wrong. But let's hope November continues to get warmer. But we are heading into colder weather, we know, at some time in the future. What plans do you have? How can you possibly accommodate your residents out there who want to meet with their loved ones? You have another facility that you have in mind where they can meet with their loved ones as the weather gets colder?
Well, Mr. Hughes is here. We do have a tent that is out front. And Mr. Hughes, what are your plans? Unmute. Mr. Hughes, you're muted. You're muted, Mr. Hughes. Okay. Okay. Oh. We'll have to
Hughes, can you do *6? *6 would unmute you.
How was that?
Okay.
Are you able to hear me now?
Yes.
Okay, so I just want to first thank Judy Birdie and the entire CAB for being so supportive throughout this time for us here at Kohler. They were always available for routine conference calls where I was able to provide update. And I must tell you that their concern for our residents and support for me and my staff really kept us going. So thank you to the CAB. As far as the visitations, there still are limits on the family visits, but here at Kohler, we are able to have family visits due to the fact that we have not had a COVID positive test in a while, so we have been having family visits. Those are ongoing. Unfortunately, the weather has been nice because we are able to hold them outside pursuant to the regulations. We have just finished constructing a tent out in the front here at Kohler, and heat is being installed. And with that, we'll be able to continue to have those outdoor visits for our families and residents, and we're very pleased that we're able to put that in place. With that, we'll continue to take advantage of the nice weather and have our residents go out to the courtyard as much as possible. Our residents are an independent population, many of them, and they are used to going outside, even as the weather gets a little cooler, so we'll look to accommodate them out in the courtyard. Thank you.
Thank you very much, Mr. Hughes. Thank you for the report, and thank you for the report of the Community Advisory Board. I'd now like to move on to Mr. Everett Person, representing Sydenham Community Advisory Board. Mr. Person, can you hear me? Mr. Person? I know we had him on earlier. He's on. Okay, we'll give him a chance. Mr. Everett Person, you're being recognized. Okay, at this time, we're going to wait for Mr. Person to be able to join us, and I'm going to recognize Dr. Katz and Mr. Person.
Oh, great.
Hi,
Hello.
how are you? Well, welcome to our
Yes.
meeting.
Okay.
It's your opportunity to present your brief report, Mr.
Okay,
Person. You're on the clock.
Thank you very much. I'd like to first say, whenever there's a new transition of team leadership, sometimes it's not very good. However, I must say, since the Mr. Farnham was there, we've been working very effectively with our cab. And with the participation of our liaison person, Ms. Ward Evans, we have a very good relationship with that leadership. But I got to give a special thanks to the Gotham senior leadership under Ms. Lewis and Cosby, because they really worked to help us.
Excuse me, Mr. Person. Mr.
Yes.
Person, can you speak a bit more clearly into your computer or your phone?
Okay, can you hear me any better?
That's better.
Hello?
Go ahead.
Is it better?
Yes,
Can you hear
yes,
me?
it is, Mr. Person. Go ahead.
Okay.
Yes.
So I was saying also that under the leadership of Ms. Lewis and Ms. Cosme, they really have supported our cab in doing so many great things in terms of the beautification of our environment. So I want to thank that group for what they've been doing for us as a cabs. In terms of the 4 testing locations, we are very happy to see that that's been working very well. However, we really wonder if that is enough, because we know that there's going to be a real tough pandemic that's going to be coming through the communities of color. And this is something we're really much concerned about. And so we ask that question as a cab, is that enough tents, and are we prepared? But we are working with that, with the leadership, and I know they're doing everything to make sure testing will be available if need be. In terms of efforts have been targeted also to ensure the patients are able to get their test results in a timely fashion. That has been somewhat of a problem, but that has been corrected, because now we understand we have a new laboratory, and many of those test results are coming back in 24 to 72 hours. And those that are coming back with positive tests, there is institutional support programs for those patients. In addition, on outreach, staff are calling the patients to make sure that they get their test results. Now, to date, Sydenham's 4 testing locations have tested 43,633 patients, and our current positivity rate on all 4 sites is 1.6%. The goal, however, is to maximize our flu vaccination rates to prevent co-infection with the COVID, because we know that a combination of the flu and the COVID-19 will be devastating effects on a large portion of our patients within our community. So we want to hopefully be ready. If there's a real dynamic that happens to our community, we want to know if we're prepared, because what the word is out, we are still facing a dark winter. Infrastructure and equipment. Right now, some great things are happening under the leadership of our senior Sydenham. Side here we're going a facelift. The patient and staff areas, waiting areas, exam rooms, and office spaces are being freshly painted. There's also our finance area is being restructured to offer the Dykeman Clinic will also be going under renovations. So we're happy to see what's going on. This is some of the things that the board has spoke to Ms. Lewis about and the leadership there about this. And so we see things are happening. And so things like iPads will also be used to conduct rounds and things of that nature. And iRounds will provide us with immediate patient feedback. There is a term that says WOW, and that stands for Workstations on Wheels. And that is to support our COVID-19 testing tents. And of course, we have a video televisit and video which is in place. The only thing we like to see, and I know it's on the drawing board for our clinics, is that we need more lighting and better professional signage in our clinics because people need to see that in the evenings and know that we're there. And so that's a good thing that we hope will be happening very soon for our St. Nick and Dykeman clinics. Patient safety and satisfaction. Patient safety and satisfaction is a continued priority by the CAB, the leadership, and everyone else. And we're supporting 3 vital committees which was in place: risk management, infection control, and patient experience. The 2 newly formed committees, the risk management committee and the patient experience committee, is a main focus. And we hope to have them to do the things we need to have. The infection control committee needs to address infection control protocols. The patient experience committee, which is created to develop a systematic approach to monitoring and addressing patient experiences at our facility. We always know we want to have our feedback from our patients because we recognize how important that is. So patients are directly notified that their concern is being addressed and informed, and what correction action the plan for the facility will take place. Frequent complaints raised by the patients. Well, one of the complaints that was raised was the call-in system. It was identified as a major point of dissatisfaction for the CAB and patients. Sydenham addressed this by identifying and training staff. This was the call-in. Sometimes we have to wait a long time to get the patient to receive a call when they call to the center. So they're very concerned about that. But I think that has been corrected. They're training staff and be able to answer the line and provide patients with immediate support. Also, they're waiting for a telephone equipment that would support the redirection of calls to the call center in order to provide enhanced round-the-clock availability to patients and to support their need. Another source of complaint for patients was increased waiting time from the COVD, and I've mentioned that we have corrected that as well. So we're doing a lot in terms of patient complaints, and we will continue to do a lot, and we're working very close with the management team there at the center. Now, in the Manhattan Borough meeting, we mentioned about the 6 blood pressure machines that was necessary, and the director of nursing did a good job of explaining why the need for those machines was there. And in the interim, it was just recently learned that our auxiliary will be buying the blood pressure machines. So they will be financing that, and we're very happy for our auxiliary for doing that. In addition, we asked for ultra unit, sound unit for the women's health program. Now, we do not know how we're going to finance that yet. Maybe it could be H&H, maybe it could be fundraising for an auxiliary. Maybe we can get some assistance from our political leaders that we work so very closely with because, as you know, we got our van through the borough president's office. So we hope to have that available for the nursing as well. So we've been doing some good things in terms of outreach. One of the things that the CAB wanted to do, and now I understand that the leadership at the center is doing, is this touching base with the NYCHA housing tenant associations, because that is the group of people that we need to touch base with, the St. Nicholas, the Dykeman houses, to begin to associate with them, let them know what we're about, and let them know that we can do things for them. And that's a big source the people that be interested in coming into our center is available right there, right in the housing project. So I know they're working on that. There's a lot of outreach going in the community, working with small businesses. We just recently had something, we worked with one of our cultural icons in the community, Vi Higginson, and we've been doing a lot of things, work with the political leaders and Inez Dickens.
Mr. Person, can you bring your remarks to a close?
Right now. It's coming to a close right now. In addition, and finally, we do outreach through our WACR radio station, 93.3 FM, and that's open to outreach to the community to let us know what we're about, and they have opportunity to speak on it. Thank you very much.
Thank you very much, Mr. Person. Are there any questions from our board members? I want to use this opportunity to remind everyone that I did something tonight. I allowed all of you to go through your entire report, reading the entire report. That will not occur in January. I'm going to ask you once again you'll have your reports in front of you. Pick out 3 highlights. If you really need to pick out a 4th, give us the 4th, but pick out 3 highlights because we have your reports. Every CAB member has your reports. So it's not necessary to read every sentence and every paragraph for the entire report. So tonight will be the last meeting where that happens. In January, we'll meet on January 5th. Whoever is on the agenda will be looking for highlights. Thank you very much for your cooperation. Now, before we finish our business tonight with the presence of Dr. Katz, I want to make mention of the fact that the Community Relations Committee met on June 9th of this year, and that our minutes have been presented to the entire board. I believe they're in order. I call for a motion to adopt the minutes.
So moved.
So moved by Dr. Katz. I've been asked to to poll each member. Dr. Katz?
Yes.
Yes. Dr. Pagan is not here.
Yes,
Yes.
He is. Hi, Dr. Pagan. How are you?
I'm doing great. And you? Yes.
And that was a yes. Okay. So
That was a yes.
unanimously, the minutes are adopted. All those in favor opposed, the minutes are adopted. I would like to introduce Dr. Katz, not for his report if he doesn't want to present it, as we have 9 minutes left, but if he has 1 or 2 messages that he'd like to deliver to members of the Community Advisory Board, the floor is certainly his.
Well, thank you, Mr. Chair, and thanks to all the Community Advisory Board members for all you do for our facilities. We're incredibly grateful, and we're more grateful now because COVID has made everything harder. And if ever there was a time that our patients and residents needed advocates, it's now. So thank you so much. I was late to get here because I've been working on the city's response to the increasing COVID cases. And my overall message to you is an old quote that it's always darkest before the dawn. So we're in a very difficult period right now. Infection rates are definitely increasing. The city may have to do more efforts at shutdown for parts of the sector if the numbers do not improve. But my major message is hope. We have a new president who is already put together a COVID task force. We have positive news about a vaccine, which is 90% effective in the early trials. We have just today, it got lost with the vaccine, but maybe more important, the FDA granted an emergency authorization for the use of an antibody treatment. This is very similar to the treatment that both President Trump got and former Governor Christie got. Both of them would fall into high-risk groups because of their weight and being men and being older. And yet both of them did exceedingly well. Antibody treatments have been around for a while, and because they're very directed, are known to be quite safe. So there's a good possibility that soon we will have much more effective treatment for those people who are infected. Those treatments are not used in the people who are sickest, but they're used to prevent people from getting sicker. And then all across the country, while there are many, many hospitalizations, fortunately, the mortality is markedly lower, again, probably because of a combination of things, better treatment, New Yorkers being very good about wearing masks and cleaning their hands and staying socially distant, which not only prevents infections, but may result in when people get infected being not as sick if the dose that they got was smaller, that may affect how sick they get. So it's going to be a couple of difficult months. Please, all of you, community members, take good care of yourselves. We need you. We love you. Take good care of your families. Find ways to celebrate the holidays without bringing large numbers of people together in the same room. Indoor activities are particularly problematic, especially without masks. Please wear your mask indoors, even with people you love, when possible, because the next couple of months, I think, will be difficult. But I think we are on the brink of major, major improvement, and I'm looking forward to a spring that might even include all of us together in a room, something I much miss. Thank you, Mr. Chair.
Thank you so much, Dr. Katz, for that message. Final business. Is there any old business before this board? Is there any new business? Hearing none, I call a motion to adjourn this meeting. Thank you all. Enjoy the holidays, enjoy Thanksgiving, enjoy Hanukkah and Christmas and the new year. We look forward to seeing all of you on January 5th, 2021. Thank you very much.
Thank you,
Everyone.
Thank you.
everybody.
Another